Randy, you're here today. Just kind of bring me up to speed with what your intent is, how you found me, what you hope to get out of all of this.
No, my intent is to try to figure out what's going on, because it gradually built, but now it's to a level that it's just unbearable. And what I'd like to get out of it is relief.
Sure. So you're having pain on the right side. That's what you're rubbing.
Yes.
And it's intermittent pain that's just, is it random?
It's random. Mostly when I talk or drink or eat.
Okay. All right. And rubbing it kind of dissipates it or short circuits it?
A little bit, yeah, I think so.
Okay. All right. So how long has this been going on?
Since about 2013. It just started off occasionally, maybe once a month.
Okay.
And then it's just progressively built up. And then about exactly 2 years ago, it became so severe I couldn't do my job.
Okay. Now, have you seen other providers to try and find the answer to what's going on?
Yes, I have one doctor, and I lost my insurance at work, so he's just continued to try to help me.
Okay.
Well, we've seen many. We've done acupuncture, myofascial treatment, what else? Massage therapy. We went to some other physiokineologist lady that did a combination of massage and something else. We went to someone who did like tapping on your. We've did anything under the sun. We've tried oils. We've tried neurologists. He's been on every medication you could think of. It's just, and he's maxed on medication. He can't take any more medication.
And honestly, it doesn't feel like it does anything.
Sure, sure. Well, that's frequently what I hear from patients. Okay, so has anybody diagnosed you with anything?
My doctor originally was thinking it was trigeminal neuralgia, but then it kept flip-flopping. And wasn't holding the true traits.
Okay. So the pain is unilateral, it's only on one side.
Correct.
Is it electric stabbing in nature, the pain?
Yes.
Okay. Is there a low, constant, dull ache that kind of accompanies the flares?
Absolutely.
Okay. So you may have more than one thing going on. All right. So certainly the things that you just said are hallmark for trigeminal neuralgia for sure. Did you have an MRI?
Had MRIs and a CAT.
Okay, and the CAT scan. What did they say about the MRI?
It came up clear, no tumors or anything like that.
Okay.
And they couldn't see anything causing this.
Okay. So is it in between your teeth and your cheek, like in your cheek, in between the teeth and the surface of your cheeks, or is it more like in the jawline,
It's like
deeper? Or?
deep in the jaw, right under the gum.
Okay.
And sometimes it feels like it comes in my tongue, because I can feel it through here too.
Yeah. Okay, and then you're holding your a little pressure point underneath the mandible there in the back on the neck. Does putting pressure there help? Okay, all right.
Sometimes chewing gum helps, but not always. But
That helped once,
Okay.
I chewed some gum, and it went away for a little bit. Well,
Okay.
not away, but livable. Mm-hmm.
Yeah, livable. Okay. So where would you put, I don't even know how to describe it because it looks painful. Where would you put your pain level on a 1 to 10 scale?
I'd probably say it's 8, but I feel I've also gotten used to it.
Okay. So today, what you're experiencing today, is that an 8 or is 8 just your average day?
8 is my average day.
Okay.
And then, of course, when it starts stabbing on it, it really hurts.
Right. So are you at an 8 now, or are you full blown 10?
When you see me going like this, I'm at full 10.
Okay.
Because I can't do anything.
Right. Okay. So, other than the thought of it being trigeminal neuralgia, nobody has given you really a diagnosis or any other things to try?
No.
Okay. So you came across some videos that we did and thought, hey, let me look at this and see if this is part of my problem. Is that fair?
Correct, yeah.
Okay. All
Because
right.
it started when I went to a dentist.
Okay. So let's talk about that. You obviously had dentistry done? Did you have an extraction done? Did you have a crown, a root canal? What happened?
I was just getting a crown and I broke my front teeth.
Okay.
And so they fixed that. And then this kind of started. They did a deep tissue cleaning.
Okay.
And then from there, this is where that all originated from.
Okay. Can you, obviously you're touching your face, but do you have a trigger zone? Like if you lightly touch your face or you shave or you brush your teeth, that can start this, or is it really more associated with talking?
Yeah, that comes and goes.
Okay.
Sometimes I can touch right here and you can't do anything about it.
Okay. All right. So it started in 2013. When did you have the crown done?
2013.
2013. So, like 6 months after the crown had started? Immediately after the crown had started? What?
Probably about a month.
Wow. Did you go back to the dentist and say, hey, did the bite feel off?
I don't know for sure, but
Don't know. Well, that's a fair statement because it's been 7 years, since then. But okay. Did the dentist try to adjust the crown or give any recommendations as to what the next step would be to help you? Because it wasn't this bad back then.
right.
Okay.
She sent me to an endodontist to redo a root canal.
Okay. Okay. So what I want to do today, part of what we're going to do is I want to look in your mouth and see how the teeth come together. I know you sent pictures because you traveled to come here, and those looked good, but that's a two-dimensional rendering of a three-dimensional object. So first thing I want to do is look and see how the teeth come together, and then we're going to hook you up to T-scan, and I'm going to have you bite into the sensor. We'll spend some time going over that data. What is that data? What does it mean? How do I interpret it? And is there a correlation that I see in the data that could explain what you're feeling? Okay. So, and then if there is, we're going to jump right into DTR therapy. But before we get there, we're going to run some tests, some biometrics that I like to help me in my diagnosis, and some x-rays and photos and all that, Anything else? How do you sleep? Can you sleep on your right side, or do you have to sleep on the left, or?
If I just get into the right position, I can. But sometimes if you touch it wrong way, it sets it off.
Does this ever wake you up in the middle of the night?
He can go from a dead sleep to on his feet and shaking his head all around.
This is quite a life changer.
Mm-hmm.
I mean, from probably where you were 7 years ago.
Absolutely.
Okay. So you guys are still sleeping in the same bed then? Okay.
I have to be careful that I don't hit her, but yeah.
Right.
Absolutely.
No, I don't. It's not a cavalier question because I've had plenty of people come in and say, "Well, my sleeping's so erratic. I don't even." And it's usually women.
Yeah.
I don't even sleep with my husband anymore. I have to. It's so bad I can't sleep on my side. I have to sleep in his captain's chair, his lazy boy, for me to sleep. And so.
No, I can't sleep if I can't see if he's sleeping.
That's fair.
Yeah.
That's fair.
And he can't sleep without me. We can't not sleep together. No one will sleep.
Okay. All right. Well, do you have any questions for me before we're not getting started? I'm just going to like lean you back, take a look. We're going to measure the T-scan, and then we'll talk about what we see.
Yeah, no question.
Okay. All right. You've just had round 1 of DTR therapy, where we were working to get the bite right, and as a consequence of that, kind of relax muscles and rebalance things. I wanted to get a feel from you how the bite feels different.
Well, I can slide my teeth back and forth.
Sure.
Before they were just locked in.
Okay. Does it feel like when you bring your teeth together, you have a repeatable home?
Yeah.
Okay. Does it feel like going from right to left, things feel balanced?
I'm not sure I'd use the word balance, but I can
Okay.
feel a difference.
Okay. So is there a word that you could use that would be more adequately descriptive of what you're noticing?
It's like they're not crashing as much.
Okay. So did they touch all at the same time?
From what I can tell, yeah.
Pretty much. Okay. And do you notice any relaxation in the face, especially the right side? So it probably feels quite different from what you came in with.
Yeah, it's a lot softer too.
A lot softer. Okay. So the muscles of the face are starting to relax if they feel softer. So a lot of times people, muscles will be really, really tight, and so they'll almost be like rope. Like you really can't massage the muscles. And so after you do this, neurologic changes occur, and a lot of times the muscles will start to unwind or relax. And so that's pretty common in what we see. So what will be interesting to see is, well, okay, if that phenomenon is linked to the pain on the right side and the spasmodic tick of the muscles to help you relieve the pain, only time will know. So
Well, they seem to have gone down.
okay,
Before when we were talking, I could barely talk.
right.
So,
I see that it's still there, but it doesn't seem as dramatic to me.
Right.
Is that
So
fair?
it's- Absolutely, that's what I was trying to point out.
Sure, sure. One of the things that I asked you before we started was, on a 1 to 10 scale, where were you? And you said an 8. Like you've been in more pain before. It was a pretty decent day, but you've had better days. How are you feeling now, if you had to give it a number?
I would probably go down to about 5.
Okay. All right, so almost 50%.
Yeah.
Not quite.
It still hurts, but
Yeah,
not like it was.
sure. And how do the shoulders feel?
My shoulders have really dropped and they're softer now.
Okay.
Before they were just like a rock.
So that's again some of those other observations that we have observed, and it's like before you came in here, you probably would have never thought that one was could have been connected to the other.
Not too much, but.
Yeah, sure. It's just like, oh man, my shoulders are really tight. So
Yeah, that's what you think.
all right,
Yeah.
well, good. So we're gonna bring you back Monday, and we'll check this all over again before you leave.
All right. Sounds like a plan.
So Randy, you're back with us. It's been 4 nights since you've had DTR, and you look, I mean, my biggest thing that I notice is you're not wincing randomly in pain and rubbing your face. Yeah, so just kind of take me through what you noticed over the weekend.
Well, I've been able to eat. The pain has been lessening. It's still there once in a while.
Sure.
But if I just wait, about 15 seconds, it's pretty much gone.
Okay. And is it fair to say that it's not as intense?
Correct.
Okay, and the duration, you said 15 seconds, the duration is shorter. Okay. Is it happening with less frequency? Meaning,
Absolutely.
okay, so it's not happening as often.
It's getting less.
It's still random though.
Only when I eat or talk.
Okay, so now it's become a functional thing where the muscles tend to have been calming down, and then only when you use them does it flare up. Is that fair to say?
Absolutely.
Okay. All right. How did you sleep over the last couple of days? Because I know you made a mention that your sleeping's pretty erratic, and sometimes this could flare up in the middle of the night, and you were kind of worried about jumping, hitting your wife, or waking her up.
Right.
How did you sleep this weekend?
I wasn't woken up by any pain at all.
It's quite the turnaround.
Yeah.
Okay.
I wasn't rolling out of bed and trying to take care of it.
Sure. That's quite a turnaround for just a couple of days.
Absolutely.
Not having surgery.
Well, I was able to eat food without any pain once in a while.
Okay.
Eat a couple of pieces and not feel it.
Sure.
Last night.
How you did make a comment that it was hard for you to find a comfortable spot to go to sleep in. Did you find that you were able to go to sleep quicker? Did it still take you a while to find a comfortable spot over the weekend?
I actually fell asleep where I was. That was pretty amazing. I didn't have to think about it. It didn't take me 3 or 4 hours to figure it out.
Sure. Okay. Well, that's important. Because it is harder to go to sleep if you're not comfortable. And so I hear frequently a lot of chronic pain patients, especially trigeminal neuralgia patients or TMB patients, will say, it's hard for me to find a comfortable position. Once I get there, I can go to sleep, but generally it's not like all night. Like I wake up, fidget, turn around, try to get comfortable all over again, and then I go to sleep for the second or third portion
or you
of the night.
stay up for 3 or 4 hours.
Right, that's the other thing. And then your sleep gets discombobulated where you're taking naps during the day because you were up all night or whatever the case may be. Randy, wanted to ask you, you look good.
I'm feeling a lot better.
Okay.
This time.
Tell me about headaches. You mentioned you put less. What have you noticed about your headaches?
Well, I'm noticing when it does come, it's not as severe and they don't last as long. And it mostly goes away without me taking a bunch of stuff.
Okay. So you'd say overall you've decreased medication?
Absolutely.
Okay. So pain behind the eyes?
That's pretty much gone.
Okay. What about problems of tracking while reading?
That's gone also.
Okay.
Yeah, I didn't realize that one.
Eye muscle twitching?
No.
No,
That's
no.
gone.
Okay. Inability to open smoothly.
It depends on the day. Some days I can open just fine. And then, like I was saying, sometimes it kind of hits a jagged thing and it shoots off like to the side.
Sure. What about the tick on the face and rubbing on the right side, lower right side? Yeah, right.
Only
in there.
when it's hitting is the only time I'll do this, or if I'm trying to talk to you.
Okay. Well, you're not doing that now when you're talking to me. So
Well,
like,
when the
does-
pain starts hitting.
Sure. Okay. So that's still there, but not as intense.
Right.
Okay.
It's definitely gone down a lot. I couldn't do anything without, trying to do this or, just try to get its attention to go away.
Okay. Is it fair to say that pain, intensity, and duration on that aspect has decreased?
Oh, absolutely.
Okay. By 50%? Half? More? Less?
I'll go 2/3.
Okay.
66%.
So yeah, okay. Well, that's quite a bit of improvement just in a couple of months.
Absolutely.
All right. And I noticed that tired muscles in the neck, shoulders, sore shoulders. You don't have any of that checked.
No, I hadn't noticed that one either. So,
All of these things that I'm bringing back to your attention are things that you originally checked back in May.
right when you say it, I'm like, yeah, I didn't check
Yeah,
that.
I don't have that now, right?
Mm-hmm.
So you had 28 symptoms, and now you've checked 7. Just to give you a comparison, right,
Wow.
as to where you are gauge-wise. So 66% in that focal area where the pain was is quite an improvement, but you've also reduced by 75%, right, the amount of symptoms that you have. And what's
Right.
remaining,
Wow.
3 of those are less
Mm-hmm.
intense. Okay?
Absolutely.
Okay, perfect. And one of them only happens when you're on the river in an inner tube or a float or a
Right.
raft, right?
Like
So-
special circumstances that
Sure.
I'm not normally in, and
Well, this is quite the response. Good for you. Good for your family.
thank you.
So I don't think we're done. I think we probably still need, a couple more visits, but I might start spacing you out just a little farther by a week or two, and letting a little bit more time lapse in between the visits, depending on what we see today. Like if you need a whole bunch of revisions, then probably will hold off on that a little bit. But if you present today and we really don't do any revisions, or we just do a little, I might space that out, because as we get towards the middle and towards the end, it starts to take longer for some of these changes to actually show up. Okay.
All right.
Any questions for me about anything?
Not at this moment. I'm just happy with where we're going, and so I'm glad you had the starting point versus where we're at. So
Yeah.
'cause-
Usually I don't show these to patients before they fill out the new signs and symptoms. But I'm happy to let you see. So this is before, and we counted them up,
wow.
everything that you put down, and then this is today.
Wow.
Thank God there's no memory for pain. Right?
Yeah. That's what I was gonna say. When you're in pain. Wow.
Good. Well, we're definitely moving in the right direction, so God bless, and I'm probably going to stop the video here, but
Okay.
I think we're at a position where we can say, this was effective to you. I think you still got more benefit left, you know,
Okay.
and a lot of that will just show up with time. Happy you did it?
Yeah. I'm just like, yeah.
Quite a life changer.
It
for you
is.
and your family.
Mm-hmm.
Well, I thank you for letting me be a part of your journey and helping you. So it was an honor for me.
Well, I was just glad I found you because they wouldn't call it trigeminal because it was all over the board.
Right. Well, and
So-
what I'm seeing is a lot of patients now are becoming their own advocate. And so those videos are out there and people watch the videos and they're like, hey, I've got a lot of these symptoms that this person has. And so I really don't fit into one of these neatly, you know, contoured boxes or one of these characterizations. So maybe this would help me, you know, and the only way to know is to do it.
Right.
You know?
So true.
But no, I'm glad we were able to bring you some relief and some help. It's very rewarding for the practitioner to see where you were, see where you are, and I know it's tremendous for your family.